Finding out that you are HIV positive is only the first step in a lifelong journey. After diagnosis, there are a number of other factors that will need to be considered. After you have an HIV positive test, take some time to consider these issues: medication, housing, food, transportation, and community support. Evaluate where you are doing well and where you could use assistance. You will need to know the difference between HIV and AIDS and other vocabulary related to your illness. You also need to understand how the disease is spread so that you can try to reduce the likelihood of infecting other people. You also need to understand what symptoms are normal and which ones mean that you need to see a doctor. In short, you do not have to tell people that you are HIV positive. You should tell anyone with whom you are sexually active or sharing needles because you may risk infecting that person. You do not have to tell employers, you do not have to tell landlords, or anyone else that you do not want to know. Every state in the United States has an HIV hotline. You can find out how to contact them online. Project Inform also has an 800 number, 1-800-822-7422, that serves people throughout the country. Learning to take lifelong medications can be difficult if you've never done it before. Once you get your prescriptions, you should plan a time to take your medication every day. You may want to use weekly pill trays to help you organize them, set alarms on your calendar, or even download an app like Care for Today that has medication reminders. Affordability of medication to treat HIV is one of the biggest barriers to care. The Ryan White Care Act provides financial support for people living with HIV to help. If you are having trouble paying for your medication, consult your doctor about how you can find funding in your area. The basic medication protocol for HIV is to take a combination of medicines that are called antiretroviral therapy. These medications help to reduce the viral load in one's blood. HOPWAS stands for the Housing Opportunities for People with AIDS program. It is a federal program that directs money to counties and cities to help with providing housing for people who are living with AIDS. If you want to find your HOPWA provider, you can go to the Housing and Urban Developments Department. They maintain a database of approved organizations in your area. Another major problem for people who are living with AIDS is being able to afford nutritious food consistently. To that end, you can ask your medical provider for information about places where you may get help with food. You also can check out feedingamerica.org if you are not aware of the food banks around you. While there are no specific dietary needs for people who've been diagnosed with HIV, you often will need to increase your calorie intake because you will need to maintain a healthy weight. Try to eat healthier foods so that you can stave off sickness as much as possible. Being safe with your foods is a bigger concern than diet. In fact, people with HIV and AIDS are more susceptible to foodborne illnesses. You should only eat eggs and meat when they are well done, and be sure to clean all surfaces thoroughly while you are cooking. Wash all fruits and vegetables before eating, and it's best if you can use a filter or boil your water to ensure that your water is safe. While drinking water is important for everyone, staying hydrated is even more important for people who are HIV positive. The medications to help control the illness can cause nausea and vomiting, making it imperative that you get enough water to drink. If you have trouble drinking water, you can try popsicles or ice cubes. When you are sick, having adequate transportation to get to doctor's visits is very important. If you are in an urban community and you don't have family nearby, you may want to contact the nearest Human Services Department to see if there are transportation options available. Many rural areas are beginning to have peer navigators who are volunteers who will drive people to doctor's appointments when they need it. Support groups can be a great way to meet other people who are already living with HIV and see how they are coping. You can try hotlines, person-to-person groups, or online support. To find a support group near you, you can search for AIDS service organization along with your location. You also can check out the stdproject.com, which has a listing of groups by state. These resources are just some of the places where you can find more information online. The U.S. Department of Veteran Affairs, the WebMD HIV and AIDS Health Center, the stdproject.com, and the Centers for Disease Control and Prevention's HIV/AIDS section. The information in this video came from these sources. For more information about HIV and other chronic illnesses, visit caringforzebras.com.